And we're live.
Great, thank you. We'll call the meeting to order and ask for a roll call, please.
Chair Moffat.
I am present.
Warden Hamilton.
Present.
Councillor Roberts.
Present.
Councillor Burton.
Present.
Councillor DeVolen.
Present.
And Detachment Commander Collings.
Present.
May I have a mover and a seconder to adopt the agenda? Councillor DeVolen, Councillor Roberts.
Moved by Councillor DeVolen, seconded by Councillor Roberts. Be it resolved that the August 25th, 2021 Haliburton County Community Safety and Wellbeing Plan Steering Committee agenda be approved.
All in favor? That is carried. Thank you. Are there any disclosures of pecuniary interest today? Being none, may I have a mover and a seconder to adopt the minutes of the previous meeting?
We actually don't have the minutes. Strategy Corp sent out a meeting summary after, so we aren't actually keeping minutes.
Okay, so will item 5 come off the agendas going forward? Okay.
Yeah.
Great. Straight to new business then, and I will turn it over to the good folks from Strategy Corp.
Wonderful. Thank you so much. I'm going to share my screen. Is that working for everybody?
Yep.
Good. Great. Seeing nods. Wonderful. Okay. So thank you all so much for taking the time again to meet with us. We have about 90 minutes today, and we really want to just spend some time to update the steering committee on some of the activities that we've been carrying out over the past couple months. We want to talk to you about some of the initial findings, so what areas are emerging as priorities, and then spending some time with you, not just updating you, but getting some of your feedback, of course, on some of the municipal roles in addressing the issues that we've identified, and having a broader discussion about the path forward. So I believe we've done roll call. I am joined today by my colleagues, Matt Tarigian and Rima Bazzi. I believe John Matheson will be joining shortly. Before I move forward, were there any questions on agenda or objectives? Okay, I'll keep moving. So, a quick status update. Since we last met, we've held 2 very productive advisory table meetings where we had a conversation about just understanding the current state, as well as starting to validate and talk about some of the priority risk areas, as well as thinking about the path forward on how to address some of them. We also have conducted a focus group with 8 participants representing Haliburton's service providers, and that included the HHS, Haliburton Housing Corporation, the Children's Services Council, CARP, Kawartha North FHT, the Central Food Network, and the Roundtable for Ending Poverty, and the HKPR District Health Unit. And just a really fantastic conversation, really insightful feedback from all of them. And it's been a really great process so far. In terms of our next engagement activities, we have 2 different things coming up. The community survey, which was actually launched on Monday, and a set of 2 community consultations that will be virtual. On the survey, we're working with the county social media contact to work with the municipal level communications person to help promote the survey in each municipality as well. And we've met with the Haliburton County Service Provider Network, and they are all involved in helping us disseminate the survey, as well as potentially help host some people who may not have access to internet and devices to participate in the virtual consultation. So we're very focused on making the engagement process accessible to as many people as possible, as it's important that we gather community input. Yes, I see Mayor Moffat.
Yeah, I have a question just about the survey. I was contacted by somebody who saw it through the county's social media channel and was very confused by it. And I'm wondering if when it needs to be explained that, and perhaps I'm wrong, we're not looking necessarily for input from people who are happily retired on a secure income, living in their own home and shopping in the grocery store every week. That this is around our more vulnerable sectors, and that and then from that, is there any concern that if can responses from secure folks skew the results, and what would happen around any of that?
Yeah, that's a really good point. And a lot of the questions that we have built into the survey are identifiers of demographic and income level. So while we don't want to limit who we allow to take the survey, because there are others with at different levels of income who have valid opinions, we also will be able to cross-tabulate the data so that we can take a look and kind of double click on the views and perspectives of those who are identifying as lower income or within those vulnerable populations. So, you know, it's a broad set of questions that we're then able to take back and actually analyze to make sure we don't have skewed information.
Okay, thanks.
No problem. Any other questions on the survey or public consultations? Okay, great. So now we're going to get into some of the findings that we have gathered through our engagement, our research. We've been working with different data owners across the county to gather information, and that is kind of the input to some of the themes that we're going to be sharing with you today. To begin, we really like to highlight, and it is incredibly important in any safety, community safety and well-being plan, to highlight the positive and make sure that it is clear what is going well and what is successful on the ground. And so, you know, a few examples of what we've been hearing about are really strong partnerships between mental health support services and mobile crisis intervention. That is something that is uniquely strong in the county and gets a lot of kudos and attention. The second one being strong and improving youth wellness initiatives. So great programs and supports for youth through different providers. Then we've got the increasing inclusion. We've been hearing about the growing acceptance and inclusion, particularly of the LGBTQ+ community. And back to the data point, while there is room for growth and there is a need to kind of, you know, have a bit of a strategy on data collection moving forward, there are lots of contacts who are holding and using very well the data that they can. And an example of that is the data coordinator in City of Kawartha Lakes. He's you know, I think he represents a step ahead of some municipalities in terms of the access and the centralization of really good and useful information. And so those are some of the strengths. Moving into the issue areas that we've identified through all of our conversations and data gathering. I'm gonna go over them at a higher level here. And then as we get into our update, Rima's going to get into a little bit more granular detail on some of these, but I will pause after this slide, and if there's any questions or points of clarification, we can definitely chat about that. So far and away, the most salient and most frequently brought up issue is housing and homelessness, and it's the issue that we're hearing about pretty much at the beginning and consistently at every meeting that we have. And again, we'll go into a little bit more of the granular definition and some of the details that we're talking about here, but that is very much top of mind for many people. There is a very close second with poverty and employment in the region. So the county is experiencing quite high levels of poverty, and this is connected to employment and unemployment, as well as access to food, secure access to food. The next point was around transportation, physical transportation that allows those who might not have access to vehicles to access services that they need. We were seeing and hearing about a bit of a gap in terms of Indigenous supports. I think something that has really been highlighted and kind of doubled down on in the pandemic situation is the mental health and substance use and addictions concerns. It was already considered to be a crisis pre-pandemic, but it has been exacerbated by pandemic conditions. So it's top of mind for many people. The need for a more holistic approach to elder care is something we're hearing about as well. So not just medical interventions, but the whole psychogeriatric component and wraparound services for our elder residents. And then we've picked up on the fact that while there are lots of great services, it's not always easy to know where to go. And then if you need more than one service, making that connection from one to another. So looking at service fragmentation, system fragmentation, and how to streamline that journey through the social service ecosystem a bit more smoothly. And then finally, what we have here is climate change. I think it's on a lot of people's minds. It's just something that they're aware of in terms of the nature that you live in Haliburton, as well as extreme temperatures and the demands that may play on energy needs, so heating and air conditioning and things like that. And so that is kind of like the long list of all the different themes that we heard about. We're going to move into a little bit more of a grouped up framework, but I just wanted to lay out the broad strokes and maybe pause here to see, is anything very clearly missing from this list? Is anything there that you think might not really warrant being there? We'd love to just pause and hear from you all on any thoughts there.
Oh, I'm the chair, so I guess I don't have to put my hand up. So in our meeting the other day, so remind me the connection between the discussion of the advisory board and this group, because we made a little change about climate change in terms of it being a priority. There's an effect. There is a disproportionate effect to those who are, underhoused or living outdoors or whatever the situation may be. But we had decided at the advisory board that climate change didn't necessarily pop up as a key issue. So can you just circle that back for me between the meeting the other day and this?
Yeah, for sure. And it's true. We are taking what we hear from the advisory table and iterating and before we come back to steering committee or have another advisory table meeting. And so what you see here on this slide is a long list of just all the different things that we heard, and it hasn't actually been formed into a set of priorities or that kind of question around cause and effect and what the county or municipalities can actually make a change on. What we're going to get into after this slide is, based on the conversation we had with the advisory table, really kind of restructuring some of these into a framework that helps us prioritize what we can actually address, and then looking at things like enablers, so things that we need to be aware of that strengthen our ability to address risk areas, as well as additional risk areas. So something like climate change, while it may not be a priority, it is something that can affect across the three that we've pulled out as preliminary priorities. So we will get into that, but really good point in just making sure that the connection and the work we do in each of these meetings is moving the needle a bit.
And I think, if I may, I just want to say, because there could be people watching, What we're speaking about right now is not in any way suggesting that climate change is not a priority in the big picture of life. It's just that for the specific outcomes and purpose of this plan, that there were other things that floated to the top more significantly. So I just think it's very important to say that, lest it be misunderstood. Councillor Roberts.
Thank you. I just wondered if only because we had a delegation yesterday at Dysart Council meeting regarding some business owners commenting on the thefts and increased crime. We've also had increase within the village of Haliburton on some vandalism and nothing serious crime. We used to get, when we had a CPAC committee, we used to get sort of reports. So maybe this question is more through you, Madam Chair of this committee, back to Dan Collins. Like, is that an issue? Is it just anecdotally that people are telling us about it? It is increased crime an issue? Or has crime increased, I should ask?
Dan, do you want to respond to that?
Yeah, sure. Yeah, we do have a recent spike. It is localized and it is all of the same nature. And we do have resources working on it right now. There's actually a project on it. So I would expect that we'll see some results and we'll see a change in that.
Thanks. I just wondered if that didn't come up as an identified issue, and maybe because maybe it's a cause of some of the other issues. I don't know.
And I wonder if it's an effect.
That's what I'm trying to say.
Yeah, excellent point. And perhaps we haven't seen it in the data because it is a recent occurrence. So I think it's important that we hear that, even if anecdotally, it's important context as we write the plan. And so definitely something that we can work in. Thank you for that.
Anybody else have anything they want to say, comment, ask? No. Okay, carry on.
Great. So this is when we get into a bit more of the prioritization and how it all fits into a framework that will really help guide us to a strong plan at the end of this process. And so based on our conversations to date and from what we're seeing in the data, we have developed the following framework. And as I mentioned, Rima is going to take you through these items in a bit more detail so that when we say housing and homelessness, there's a little bit more context on, okay, what does that mean in Haliburton? But I'm just going to frame up the way that we're thinking about this. I see a hand.
Yeah, so do I. Brent, go ahead.
Yeah, just as I look at this, so the past number of years, the city of Kawartha Lakes in Haliburton County, all of these things that I'm looking on here, we have the JAC committee, which is basically human services and modern lingo. We have the housing corporation. We have the poverty reduction. Every one of these things, we've been attached at the hip with the city of Kawartha Lakes, and these things with stakeholders have all been done. And my question is a fundamental one. With this happening within Haliburton County, does this mean we disengage? Like I said on a pile of committees there that I just see a lot of duplications. I'd like to understand the mechanics of that. And the other part of it is that we pay into. They have staff and expertise that we don't in Haliburton County. And back to, like I say, the big picture, if this is a Haliburton County, apart from us building our own bureaucracy with these all sort of things, how is that going to roll out? And that's a big, big question. And I don't necessarily need all the answers today, but it needs to be front and foremost in your mind with wherever we're going to end up with recommendations at the other end of this.
Yeah, absolutely. I see John's
Sure. If you want me
picture
to
lighting
take,
up.
sure. If you wanted me to take a quick stab at that. I mean, right now we're at the issue identification stage, and I think you're absolutely right, Councillor, that this isn't about setting up a parallel set of bureaucracies. This is about identifying gaps in the way in which your existing services meet the needs of your existing population. And so really all we're hoping to get out of these sorts of lists are, have we identified the most pressing gaps? And I think one of the interesting things about Councillor Roberts' question was you see here that these things tend to be all about people versus their circumstance, and, with a common theme of either sort of, well, you easily see what the common themes speak for themselves, but what was one of the things that wasn't here was person versus person violence, whether it be, domestic or otherwise. And another thing that didn't come up the way it has in some other projects that we've worked on was the relationship between individuals and the people who are meant to keep them safe. So that hasn't come up yet either, which is like, it's a good sign. But I think at this stage, what we have to do is make sure that the issues sound like what's really on the mind of Halliburton. And then the next phase, to your point about it being a big question and a longer question, is that leads to the gap identification, and then what do you do about it? And it certainly wouldn't be anything that Strategy Corp would write that you have to abandon all your existing relationships. It would be about identifying how I think it's the point there about streamlined system access navigation and data collection and sharing and continuous stakeholder engagement, how those tools can be used to better address the risk factors that are being identified and better mitigate the priority outcomes that are being identified. That'll come about by filling gaps, not by doing overlap and duplication. So your question's really well taken.
Yeah, and I would just add, I don't have much to add to that, but you'll see as we chat a little bit about the path forward and some of the conversations we had with the advisory table, there was a similar response of, we actually have been doing a lot of great work. And in some cases, it's just about, making sure that we implement the recommendations out of existing reports. And so I think that this serves as a place for all of that to come together. And really take a system-wide view. But yeah, as John said, definitely not to abandon any relationships. It's more about shining a light on those and making sure everyone's aware of them.
If I can just add, there's sometimes people say, well, what do you actually learn in a political science course? And one thing that I think I never forgot was in the hugely important study of the Kennedy White House during the Cuban Missile Crisis, Graham T. Allison wrote the adage that where you stand depends on where you sit. And to take a fabulous many 100-page book and summarize it to a bumper sticker, it turned out that the advice of the Navy was to blockade things, that the advice of the Air Force was to bomb things, and that the advice of the infantry was to invade things. And that the essence of the Kennedy White House was to say, well, look, I don't like any of those options. I want to come up with something that works for us. And you might say, why am I sharing that with you? Well, we have a really great table and really great people who are leaders in the service delivery in your community. But to some degree, they're a bit like the Navy and the Air Force and the Army. The people who provide the services that they provide would love a 5% increase to be able to meet their unmet need. And what we got to make sure in this community safety and well-being plan is not that we're just rounding up the usual suspects of people doing what they always do and expecting that it'll fill gaps. It's about identifying the gaps that exist between the services that you have that'll get you to the truly innovative solutions and identify the gaps that are there. And that's where the whole provincial community safety and well-being planning framework puts the focus, tries to move it away from incident response and up to sort of the value added chain to make things happen for people in a better way before we get to the scary red button in the middle. And maybe we're doing stuff that's further up at risk intervention or prevention. And so I think on any of these multidisciplinary exercises, the most important thing is that we not fall into what Graham T. Allison referred to as standard operational procedures, but rather we think about the interoperative procedures that you can come up with that cut across the silos. And that's why the data collection and governance of all of this is so important, because as soon as you start talking on that cross-silo basis, you enable all kinds of things that are different than what you ever might have been able to achieve before. So I actually think your question goes to the very root of this thing and why it why it can be good as opposed to duplicative. But that's that next phase that really has to get there with the real creativity. So
Yeah, thank you for that. And I'm going to just reiterate something I said at the advisory table the other day, was that I will look at my notes, is that one of the questions was about what's everybody's role. And I'd said before this meeting started that you could look at this draft that we're discussing today and immediately become frightened by what appears or could appear to be a big long shopping list of responsibility by local government. And I think one of the key aspects, and to Brent's comment about duplication, is to use the information to tease out the way where local government can dovetail with existing services to make it better, and provide a sort of a softer landing at the front end, but without bearing 100% of the financial or the operational burden, particularly when much of the work that's being done by the people on the ground is outside of our governance doctrine. So there's a tremendous opportunity to, as you say, fill the gaps. And the other day I made the comment, and I didn't mean to make it lightly, but sort of the game of go fish is not to say, well, the county has to do all this stuff to make it a better place. It's a matter of saying, what are we already doing that we can just enhance or incrementally advance or look at differently or dovetail with to fill those gaps and make it and make some of those things either better or go away. It's going to take a while for us to get there, because we are all very used to living in, as Brent says, committees that are run or owned by City of Kawartha Lakes. And it's going to take some conversation to tease some of that stuff out, I think, going forward. But anyway, carry on.
Great. This is exactly the type of feedback and conversation we're hoping for. So thank you for that. Just to provide a little bit of an overview on the visual on the left side, we have our priority focus areas, and these are preliminary, but just based on the engagement to date, again, the data that we've looked at, these are the things that are coming up as areas that require the most attention. So the housing and homelessness, poverty and food insecurity, as well as unemployment piece, and physical and mental health. And these are big issues, but they are the ones that are coming up over and over again as the kind of foundational problems that many in the community are facing. And a really interesting point that came out on last week at the advisory table meeting on the housing point was that it's not just low income people who are facing these challenges. There is a bit of what's being called a missing middle in housing. And so it's increasingly affecting more and more people at all levels of income. So, excuse me, that's just a little extra nuance there. Our next layer here is what we've identified as critical enablers. And these are the things that can actually help us address these priority areas. And we're hearing that there needs to be easy access to the system. It needs to be easy to navigate with fewer entry points, and clearer inroads and access to providers. Adequate transportation to help those who do not have vehicles access the services they need. Multi-sectoral data and evidence collection, so that this can enable a better understanding of different trends, gaps, priorities, and successes, excuse me, across the county, in real time and in perpetuity, and not just a snapshot in time. And then finally, just speaking to the community, making sure that they're being heard. There's a lot of nuance that you get from community engagement that you don't necessarily get out of the data or surveys. So these are the themes on what people are feeling needs to be there as a strong foundation to address some of the challenges that are being faced. And then to the earlier point about where do other risks that are still important but maybe not be priorities fit in. And the climate change point here, the large geographic distribution of the county and how that affects transportation and accessing different services. And then finally, the population and demographic-based challenges, and the fact that some populations and groups are disproportionately represented when it comes to needing health and social services. And so these are a few. There are likely more additional risk factors, but we find that they can be cross-cutting and affect or play into some of the three priorities that we have up top here. And so this is just a way of organizing our thoughts. And then moving to the right side of the slide here, we're beginning to validate these focus areas. We're also starting to think about strategies and interventions to help address or mitigate them. And the CSWB planning framework developed by the province provides a really useful structure when we're thinking about different types of responses along a continuum. So here we have the 4 different layers, starting with the more preemptive social intervention and then getting down to the more reactive incident response. So this is just a helpful way to organize our thoughts as we think about addressing these issues. And we felt that using this framework as a way to guide our conversation is going to help us create a plan that is, asset-based, what already exists, what plans are in process, solution-oriented, so not just focused on the issue, what are we going to do about it, context-specific, to reflect the reality of the county and its municipalities, and inclusive, so making sure that we're hearing from the right people and a good number of people on what they hope to see. So a lot of information, lots of different boxes on a page here, but just wanted to pause and see if this overall summary and framework is resonating with the group, if anything is not sitting right or confusing.
Any thoughts from anybody on the committee? Okay, it's early days yet, and it's an awful lot to consume. So we'll carry on. Questions could come forward as we move along.
Yeah, for sure, and it's never too late to ask. Okay, so Rima is now going to go into. I think this is where maybe some questions might arise. Rima's going to go into some detail on the components on the left-hand side. And so we'll tease out a little bit more detail on what we're actually hearing. And I think that this will help provide a little bit more context for conversation. I'm going to hand it off to Rima now, and she'll walk you through some of this very text-heavy slide.
Perfect. Thanks so much, Lauren. So as mentioned, essentially what we've done is we've taken all of the sort of the long list issue area items that Lauren discussed, and we've distilled them into priority focus areas, critical enablers, as well as the additional and exacerbating risk factors, the latter two, which I'll get into more detail in a moment here. So the key focus areas that we've identified are housing and homelessness, poverty and food insecurity, and then physical and mental health. I won't go through every single bullet point here, but I'll try to provide an overview that at least will provide a bit of a context here for us to discuss. So from a housing and homelessness perspective, the housing context is very much characterized by a lack of housing stock across the continuum. So what we mean by this is, and Lauren already alluded to this a little bit, is that there are challenges in accessing housing, whether somebody is low income, whether somebody is experiencing poverty, or whether somebody is considered middle or higher income. Of course, the contexts and the challenges are different. But the point here is that there is a general shortage of housing that is accessible to residents in the county. The second kind of key point here that is a unique, a relatively unique feature of the housing context in the county is that there is a significant challenge with invisible homelessness. So people are, may not have access to stable housing, but they may also be, not experiencing homelessness in sort of the conventional way that we would imagine. So, items such as couch surfing, staying with friends and family, living in their cars, things of that nature also inform the homelessness context in the county. There is significant displacement due to evictions, and from what we've heard, evictions at times do not necessarily follow the processes in place. So issues in terms of tenant rights are an emerging challenge that we're hearing about as well. In terms of the latter 2 points in housing and homelessness, we do also want to emphasize that there are folks that experience challenges in terms of the conditions of housing because they've owned homes from some time ago, but have difficulty in terms of upholding the sort of conditions of their homes, which basically means that they end up living in substandard housing conditions, but also that they cannot sell their homes at a market value. So, we've heard this referred to as stuck assets. And I think that term is quite appropriate in this case as well, or in terms of characterizing this case. Lastly, we heard this time and time again in terms of, the access of a shelter within the county. We recognize that the county does, support a shelter that is located within Kawartha Lakes. But I think the key thing here is that it is challenging for people experiencing homelessness to actually access that shelter, given the distance away from what is still considered home for those experiencing homelessness. Relatedly, poverty and food insecurity is a key focus area and priority that we've heard about time and time again. We know that the county experiences, one of the highest child poverty as well as general poverty rates in the province. And I think it's notable for us to mention that the poverty profile is not necessarily just folks who are unemployed, but also folks who may be employed but are employed in positions that are that don't provide a living wage. So we see people who are employed but are also enrolled in Ontario Works program. So we see a little bit of a nuance there and a little bit of a context piece around the quality of jobs available within the county. Relatedly, the county has the second highest cost of living just after Toronto, which is quite significant, meaning that a living wage would need to be somewhere around $19.50 an hour, which is, again, quite significant. Because of this poverty context, we're seeing issues related to energy poverty as well as food insecurity. So in terms of energy poverty, referring to the amount that people spend on energy relative to their total income. So that's increasing, and we're also expecting that to be exacerbated by potential changes in the environment and climate change. And in terms of food insecurity, concentrated mainly among low-income folks, it's both access to quality foods, but also in terms of proximity to quality grocers, as well as the affordability of quality foods. When we think about physical and mental health perspectives, we're hearing that there is a significant resource shortage. We understand that there is, a single addictions worker to support communities within the county. And because of that being a single role, there is obviously issues and challenges with regards to outreach, which is a key role in supporting folks experiencing mental health, given the barriers that they face in potentially identifying services and locating services. From a physical health perspective, we understand that there is a limited infrastructure in the county to support active transportation. So what we mean by this, of course, is, safe and usable sidewalks, bike paths, things that support connectivity within the county that go beyond sort of the physical public transportation infrastructures like buses or taxis or Ubers. So I can pause there before we move into the critical enablers and additional exacerbating factors. They are related to these priority areas, but I know this is a lot of information. So we can just pause here and take some questions or comments.
Are there any questions, comments? Andrea?
Thanks. That's pretty shocking that it's the county has the second highest cost of living. I mean, that's not something that we want to be not proud of, but it is what it is. And with the housing stock, obviously I would suspect your statistics are current, because 2020 was a huge increase in the cost of housing, but 2021 has gone even through the roof for off water. I know of a condo that just sold a week ago that went for 50,000 over asking, multiple offers. They'd said they've never seen multiple offers on the condos in town. And these are not you'd class it as a starter home either.
Mhm.
And there's nothing like that. And I also appreciate so I guess my comment is, are the statistics as current as can
Yeah.
be, and we know that the trajectory is still going up, which is also not good. And I just relate to the energy poverty. My husband and I used to own a home heating oil business, and we saw a very sad side of people just scraping by to pay their oil bills and getting our minimum deliveries and everything like that. And the problem was they were living in poorly insulated houses and they couldn't afford to insulate their house. So it was a vicious cycle. So yeah, I just comment on that one. Thanks.
And one of the things too that I've been saying is at the advisory board level is, as I mentioned at the beginning of this meeting, is trying to find the way that local government can assist. So, and we did talk about the sort of the heat bank the other day, and so there's Fuel for Warmth from the heat bank who are attempting to, help with energy poverty. And so, okay, as an example, you say, well, what are we going to do about that? So the county isn't going to pay someone's bill, but what we can do, and it might be a little bit too far back in the house that Jack built, but we all speak at lake meetings, and lake associations always give money to the food bank, and they give money to the fire department, and they give money to, there's lots of lake associations that write checks. So how about, and I've, really big on the communication. There's a whole portion, a huge portion of Haliburton County and its dedicated souls that really don't know that any of this is happening behind the line of trees. So how do we as elected officials get the message out that, maybe a lake association donation this year should go to the heat bank to support those people? Because as more and more people are moving here, as Andrea said, through the pandemic has shown us a lot of challenges. There's more people coming here who want more things done by more people. And every day you see on the Minden Haliburton News Network Facebook page, there's one that was posted this morning. I've taken a job in the area as a whatever job, and I have nowhere to live. Can anyone help find me an apartment? So I think what the role of local government is not to just put a Band-Aid on these things, but try and find innovative ways to increase knowledge, open up opportunities within its own operational construct. So it might not be just building houses, because the county isn't going to build houses, but we're taking action on short-term rentals to hopefully stabilize that housing market. We can pay more attention to our housing plan, not that we're not paying any attention to it. There's incentives that have come to light under the More Homes, More Choices Act. So there's things that we can do, and it's going to take us innovatively thinking what we can do inside our own operations to just, again, I keep saying, just sort of incrementalize the process toward getting some of these things done. And it's not going to be easy, but we can keep brainstorming the local government role in this, because we can't tell the mental health workers what to do. Not that we would. We're not child mental health experts. We're not the police, but we work with them. So that's the part I find really exciting, is trying to find the way for us to plug into making change. But I'll stop now. Carry on.
Absolutely. No, that's an excellent point. Any other comments on the priority focus areas before we move into the next slide? All right. So as mentioned, we have identified us, and then also through our engagements with the advisory table, have identified the critical enablers. So key things that, should exist, or key conditions that should exist so that we can address these priority areas. But we've also identified the additional or exacerbating risk factors. So things that will likely pose an additional or add an additional layer of challenge to the priority areas that we've discussed. So from a critical enablers perspective, firstly, we've identified the streamlined system access and navigation. So key to support the alleviation of housing and homelessness issues, poverty and food insecurity, physical and mental health, is the ease of system navigation. So making sure that folks know the services that are available to them, how to access them, and where is a key function here. When we talk about transportation, both public and active, having the correct infrastructures in place will allow, distal communities to be able to access services better, and it will overall improve the connectivity within the county. And of course, when I say connectivity in this case, I mean the ability to move between different places within the county with ease. The third is the continuous stakeholder and community engagement. What we mean by this is in order to ensure that the CSWB plan is continuously relevant, continuously impactful, and continuously inclusive, we want to make sure that we're engaging with service providers, community members, so that we know what's changing and how, and whether the plan is effective at achieving the desired objectives and outcomes that are set out during this process. And lastly, Lauren mentioned this a little bit, so I won't repeat too much, but in terms of data collection and sharing, we've heard time and time again that there's not really a lack of will, but a lack of structure. We know that folks are collecting data at different times and in different ways, but creating that integration and ensuring that there are sort of consistent parameters for data collection. So around specific social indicators or health indicators, for example, will create more of a cohesive approach to the data collection and sharing mechanisms within the county. So I'll say that, but I'll also add that we know that there is, again, a strong relationship with the CKL data coordinator. So perhaps it's building on those existing relationships and developing something even more formalized. In terms of additional risk factors, when we talk about environment and climate change, really what we're trying to say here is that environment and climate change will have a disproportionate impact on communities that are already vulnerable. So really emphasizing the impact piece here. When we talk about energy poverty, for example, it's really going to be accentuated among those that are already within these sort of low income brackets or experiencing poverty. But we're also thinking about, the impact of a lack of shelter and exposure to changing temperatures, whether it's getting colder or hotter. So that's really what we're trying to drive home with this point as a risk factor and exacerbating factor. Geographic distribution related to public transportation, and also the point on Indigenous support mentioned a little bit earlier. Based on where folks and community members live and where service provision is facilitated, it makes it a little bit more difficult for certain community members to access services because they'll have to travel to specific places in order to reach those services. And then relatedly, from a population and demographic based challenges perspective, what we're really talking about here is that intersectional approach. So understanding that based on somebody's identity, health, age, income status, among other factors, they may experience challenges that are differentiated as it relates to the priority areas that I just discussed. So I think, I think that this essentially sort of sums it up in terms of the full approach, but I can pause here as well before we move into the remaining discussion points and see if there was any comments or questions.
Anything from anybody here? All right, carry on, please. Oh, Councillor Burton.
Thanks, Carol. I guess my question is, I'm a little bit confused with the, I'll use Highlands East and maybe part of Dysart as well, as a lot of our people migrate to Bancroft or to other healthcare and OPP. I just wonder, and I hope that the Bancroft plan was certainly looked at, and I hope that we're running somewhat parallel with them with what we're doing.
Yeah, so we have looked at the most current available Bancroft plan. I don't know if they've published their 2021 yet. I know that they were working in a county effort to do that. There is definitely some similarities. The themes from the previous plan were more specific to things like person-on-person violence and theft, which we just haven't been hearing as much here. However, the point on the connection between the two and, the fact that it's not just inside to the county and there's some crossover of services and service provision between is a really important context point. So we'll make sure that when we are looking at further defining this framework, as well as looking at solutions in the future, that we are looking at some of the things that Bancroft has put or in their county or regional plan that they've done for sure.
Thank you.
Thanks for bringing that up, Dave, because that does remind me that Algonquin Highlands is in the same boat with with Muskoka. So I don't know, half of Algonquin Highlands gravitates to Bracebridge and Huntsville. And so I remember, I'm just sort of clawing back in my memory that one of the questions that I had asked, I believe we'd spoken previously about this in getting organized, was that the province felt, or maybe it was around detachment boards, but the province felt that it was the responsibility of the people involved, which would be us, to make sure that we're liaising cross-border for similarities. So I don't know, to Dave's point, have you had any contact with the District of Muskoka or any of its lower tiers? It's also a 2-tier system in terms of what they're doing and their plans.
So I know that we did reach out to Bancroft to look for data from their OPP detachment there. We have not been in touch with Muskoka on what they're looking at. It's something that we could do, just to take a look at what's there. We look at what's publicly available, but haven't had sort of behind the scenes conversations on their internal processes.
And so then how, because we're admittedly, I feel a bit late to the party on this. How do we, at this stage of this process, I mean, we're kind of at the beginning, but we're kind of not at the beginning. How do we incorporate what's happening that would serve a huge portion of certainly Algonquin Highlands, that those folks that navigate north and west? What should we do about that to make sure, like, you can reach out to Muskoka, I guess, but is there anything that I should be doing with my counterparts across the boundary there, or what would you suggest? Not that I want to do that, but it's your job. But you know what I mean? How do we address that now that we're part way?
Look, what I would suggest is that we take that offline and figure it out and come back to you with some recommendations. I don't think we should be abstracting that in a public meeting. But I think generally it's accepted that you get a certain amount of overlap and duplication between the plans. You know, I think it's, what's most important is that this isn't going to be a plan that is going to be put on a shelf and forgotten, right? What it is it's a different way of doing business 365 days of every year going forward, where ideally you will never be as insular after as you were before across the silos within areas. And that provides a platform for you to collaborate across areas. And I don't think it's in any way going to take away from this process to keep it focused the way it is, and then use it once it's built to do the collaborative stuff to the degree that you've got other areas that are serviced by other detachments. Because interjurisdictional stuff is so inherent to almost every aspect of this thing that it's going to be a reality as we move forward. And certainly we're going to be able to get the public input without regard to those service delivery barriers. Or I don't want to call them barriers, just service delivery areas. So I think we can, you know, build some extra consultation in, and we can work with the CAO to figure out, and also with Dan Collins to figure out, you know, if there's anything he wants us to speak to with his OPP colleagues. But let's take that offline and decide if there's anything that needs to be done that goes beyond what I just said.
Okay, I just Googled it, so they're doing their community's input. So if you want to carry on, that'd be great.
Sure, great, thank you. I just want to make sure that no one else had any input into this or questions about this before we do move on. Okay, great. So we've got just over half an hour left, and we did want to have an opportunity to hear from you and not just speak at you and update you on what's already been discussed and talked about, because your perspective and input is so important in making sure that this plan works and lives after it's published. And so At our last advisory table meeting, we began a discussion on each of the 3 priority areas and asked the following questions. How do we respond to these issues? So housing and homelessness, poverty and food insecurity, and then mental and physical health. And what do these responses actually look like? Are they new services or service enhancements, or are they partnerships? Does this already exist and we're just not talking about it? The next question is, what is required to enable these responses? So once we say what we think we need, how do we actually get it off the ground? Is it resources? And if it's, resources is always an issue, what is it beyond that? What can we do with what we already have? And to Mayor Moffat's point, how can we be innovative and play this game of go fish to figure out what's going on the ground, and how we can partner to deliver some of these services. And then our final piece was around barriers to actually implementing these responses. And again, resources and infrastructure generally come up, but it was a really useful source of information and input from the advisory table to just understand where some of the pain points are for them as providers, as well as where they're seeing their clients really need extra support. So I'm just going to do a little bit more talking and give you a summary on some of the types of responses that we heard, and then we're going to stop and again, back to Mayor Moffat's point, is maybe we can have a very early conversation about the municipal role in addressing some of these issues. So on question 1, we heard that scaling up existing solutions, interventions, committee work, to Councillor DeVolen's point, and really making sure that the good work that's already being done doesn't drop off, and that if something needs to be implemented, it is. And we were given an example of the housing and homelessness plan, which is a very strong plan, but it just may not be being implemented right now in the way that it could be. Providing a single point of access to services. So this is something that comes up whenever you talk about health and human services, social services ecosystem, is this idea of balancing the focus between the journey of the client, as well as the services being provided to actually figure out the best way to streamline and triage a client's needs. And so we talked a little bit about what that might look like. And then mapping resources to demographics and need. So really figuring out what the needs are, where, and by who. And so a part of the exercise that we're undertaking is an asset map and just plotting out where all of these services are across the county, as a starting point to just understand where there may be physical gaps, as well as service gaps of different types of supports. On question 2, some of the responses we heard were that it's really important to address these issues, that the service providers and the municipality and anyone who's helping these people who are looking for supports are helping to increase their knowledge and awareness of what's available to them. So, enabling their independence to navigate the system and make sure that people are know what's available to them. And then this is the point that we're going to get to shortly, but clearly defining how local government, as well as the role of the service providers themselves in actually bringing some of these to life. And then finally, on barriers, it's generally focused on resourcing. And so it's not just money, but it's also attracting the right human infrastructure. Someone called it the people who actually come and live in the county, who can afford homes to live in the county, and then provide these services. So that was an interesting and very interconnected point that came out. So this is some of what we've heard and talked about, and these are, again, big issues, not things that are going to be solved in the next half an hour. But it is really important that we feed this back to you, so you know the information that we're gathering, and then hear from you on some of your thoughts. So I'm going to just come back to this landing page kind of placemat, which lays out some of the priorities and then different ways of looking at interventions or responses. And then in the bottom right corner here, we have a question around what is the role of municipal government in dealing with some of these things. And instead of going one by one, priority by priority, maybe we can take a moment and, you know, again, back to Mayor Moffat's great point about how can we talk about innovative ways to address some of these issues, even if it's, you know, again, shining the light on something that's already happening on the ground. It would be great to hear some thoughts from you all on what you might like to see included in the plan when it comes to the county and the municipalities driving some of this forward.
Thoughts from the steering committee? Andrea's going to say something.
No, I'm not really sure what to say. I appreciate all the work that has been done to date, and this update now, and all the people that will be doing the survey and the working group. We're the steering committee, the working group. Sorry for the names. Yeah, no, I don't. I'm just thinking.
Thank you for that. Sorry to put you on the spot there. It's a big think. It is. Liz.
Yeah, it's a lot to take in, especially when all the work behind the scenes just sort of comes at us all at once. But you know, it's going to be interesting to see how things fall out, because there's some things that the municipalities can do, and some things that would land at the county's table, and you know exactly how that gets divvied up and how that works will be interesting.
Well, and I think that's exactly what I mean by, and again, not to be disrespectful about sort of the go fish idea, and the strategy core folks are probably tired of hearing this, but one of the things I'd said was, well, if we have a whole bunch of vulnerable people in the community who don't have access to healthcare providers, we just got $3 million+ to expand the community paramedicine program. So is that something the county could consider? I'm not saying we should do that, but there's a conversation, is try and tease out a way that to expand the community paramedicine program to help folks who are not able to get out to have access to that service. So that's what I mean by the sort of incremental and dovetailing of what we can do. And I would love us to, it's also why at our last meeting, I had said around the report for the $145,000 for the content creator in the tourism department, is that I knew this was coming, and said folks need to get their head around maybe a different shift. This is not, it was somewhere in the slide, it's not an issue of political will. I think it's an issue of political knowledge and breaking down silos. And I believe that Haliburton County and its elected officials and staff will do the right thing where they can and when they can. But as has been said, we can't just be the magic wand. So the work is in exactly that, Liz. The work is in saying, well, here are the needs. What do we know? What do we have? What do we got? What can we do? And there will be a lot of no's or I don't knows, but there will be places where hopefully we can do something. And maybe it's a shift. Maybe we have to look at how we budget and shift more into assisting into creating a solid foundation for the community from which it can grow, instead of continuing to have this. But anyway, food for thought for a lot of reasons. Andrea.
I will try to say something a little bit more eloquent than my blabber when I just spoke a minute ago. I think we're already in a fairly good position here in Haliburton County, and that the people involved at the table were already interconnected. We're already speaking. We're now laying out this formal plan. But I know, Dan, with your predecessor, when we were on the CPAC committee, and I don't remember what the table was called, but there was an informal social services, policing, mental health table already happening, where you felt that you were able to talk about specific people and situations that were interconnected already. Like somebody isn't just going to this store and robbing, generally maybe they've got a drug issue, and then why do they have a drug issue, and then maybe it's a mental health issue, and so it's all interconnected. But I know that a lot of things already happening, because we are small, there's already those networking and organizational conversations happening. And I think this is sort of laying that out in a bit more of a formal setting.
Dan, are you going to respond to that?
Yes, thank you. So I'm aware of, and I was involved in the past with a youth justice council, and that was just like Andrea spoke of. And I know Leanne and Sergeant Rob Gadea were involved with that quite a bit in the past, and that was involving all the partners with respect to youth issues. So like Children's Aid was involved, mental health, the school board, us. A whole bunch of resources, local resources, and there was always good results there. Other things that are currently in place are local court management advisory board. That's between Kawartha Lakes and Haliburton County, because all of the court is in Lindsay. It's in City Kawartha Lakes. So that's where the local law enforcement partners and the Crown's office get together. It's been by Skype this past, it's usually quarterly or biannually when required, and chaired by the Crown, the head Crown. And we just had a meeting just recently, and it's all discussing judiciary issues and challenges between folks getting from dealing with police to getting through the court system. So yes, there are situation tables in the past. And there are a couple still going on now. Yeah.
Any other thoughts from anyone? Mr. Rudder.
I guess I think sometimes we think we're small, and so everybody knows what we're doing. And what I think is really valuable about this process is it has given the county a seat at the table, where we weren't previously connected that way. In many ways, I think, because the City of Kawartha Lakes were our consolidated service manager for social services. And so we assumed that information was flowing, and I don't think it necessarily was. And I was invited to give a county update at the Service Providers Network in the winter. And I think I'm safe to say that I don't think they knew that we were spending almost $250,000 to fund new units under the housing and under our housing and homelessness plan and our affordable housing targets program. And I suspect before long, our local municipalities will be matching that. I don't think they knew that we were spending $285,000 a year plus to maintain existing affordable housing units. And that was happening every year. I don't think they knew that we were setting aside $50,000 for the, when the time was right to look at a transportation or a transit system in rural Haliburton County. So I think we assumed they knew what we were up to, but they didn't. I think I'm safe in saying that. And so I can remember one person making a comment, you guys really need a communications person, because you're doing lots of great stuff. You're just not telling anyone about it. And I think even some of the issues that have come up around, someone mentioned insulation. It wasn't the fact that they were living in very poorly insulated homes. We have a home improvement program funded through City of Kawartha Lakes, but it's funded by us. It's not that actually helps with that, and actually is undersubscribed almost every year. And so those are things I think are happening, but people don't know about them. We're not communicating that availability well enough. And so it really is part of that continuous engagement with stakeholders, letting them know what's available, making sure we connect with Haliburton County people to let them know that those services are there, and that we're doing things. And maybe those programs need to be more robust. Maybe they need to be communicated more effectively, But there are lots of programs out there. There are a lot, we're doing things to help people. It's somehow the message just isn't connecting.
Yeah, and I think that goes back to what we said earlier. I've asked why can't we have, the County of Haliburton portal for all this information, and then back to Brent's question is that we have a fairly voiceless seat at some of these CKL tables, and I'm sorry if that offends anybody, but that's a fact. And I think there's a conversation to be had, a really good opportunity to touch base. It was mentioned about formalizing the data gathering relationship. So there's some really good conversations to have where we can sit at the grown-up table around some of these things in our relationship with CKL for a positive outcome for everybody. And I think those are things that we can do in the County of Haliburton that can, incrementally facilitate forward movement on some of this stuff. And so that's the kind of conversation we need to have is what is it? What does it look like? Who is it involved and how do we do it? Come on, Brent.
Yeah, I'm just, I've been collecting my thoughts. I'm kind of a numbers and mathematical guy, and it's kind of like you're a 10 or a 12 set Venn diagram with all of these elements that we're trying to use as a tool to come to some positive conclusions. I mean, I'm encouraged by the creation of this gives us a potential that the conversation is held here and we have more direct engagement, that those good things that are already happening, that we give voice to it, that people know and more people can take advantage of it, and that we may be able to supplement and augment some of those so that we can do even more. But in lots of the seeds of these, and academically being an economist, the roots of our housing and homelessness and a lot of poverty have to do with problems in the labor market and education that are many decades old, that have put a lot of people in places where we don't need them anymore. Having said that, I'm an optimist. The glass is half full, that we continue on in this process and we identify, make it more the one-stop shopping, and people know that we'll have more positive outcomes going forward. We know on an individual level, we're still somewhat a small community that we know, and those their interpersonal relationships. But with rapid growth and more new people to our community, that being the Band-Aid that covers all is quickly coming to an end. So we need something to get beyond that. And I'm cautiously optimistic that this perhaps can be the vehicle that we can use to achieve that.
Well put. Any other thoughts, comments, ideas at the moment?
Madam Chair, I know Matt's had his hand up, and then I wouldn't mind jumping in too. But
Oh, I see Matt's got his little picture hand up.
Yes. Just trying to behave myself. Thank you, Your Worship. And just looking at this, I mean, from the perspective of where this was intended to head, and as far as the legislation is concerned, I think all of your collective leadership on this deserves applauding. This is exactly where the whole community safety and wellbeing plan and planning was intended to go. And this slide in particular is important because what has traditionally always been missing is that risk intervention band. That's the gap that was intended to be filled in as a result of putting all of these plans together at the local level, and what has been identified as the risk factors in the priority areas is perfect. I know it's not lost on anyone that this was in the Police Services Act. It is in the Police Services Act, I should say. And so there is a very direct connection to bending the cost curve down for policing in the community by, and I think you said it, Your Worship, finding greater or better outcomes as a result of the policies that get put in place in response to the identified needs. And the data here is important. Whether there is data that emerges from the situation tables that Dan discussed and described, but there are other areas where that data collection and sharing is also critically important. So I just from an observation, I think this is headed absolutely in the right direction, and it's well laid out at the local level.
That's very good to hear. Thank you for those comments. It's very encouraging. I saw another hand somewhere. John.
Yeah, I just wanted to add, the language is kind of formal when you start saying it all sounds very academic and learned, streamlined system access and navigation. But really that just means I didn't know I could access it. And, it's kind of heartbreaking if somebody needs help and they didn't know they could access it. And transportation sounds like it's an invitation to have empty buses running up and down county roads, but it's not. It's just designed to deal with, I couldn't get myself there. And so yeah, you do it at Bancroft, but I couldn't get myself there. And there's all sorts of ways to get people there without having empty public transit buses moving on fixed routes now that we're in 2021. And the data collection and sharing sounds kind of remote, but how many times have you heard, well, either we didn't know the person needed the help, or, well, we knew the person needed the help, but we didn't tell you. And why? Because we didn't know that you could help, or we didn't know that you cared, right? And I think to the CAO's point, if we need a communication strategy to let other entities know that we care, then this is a great tool for helping to address that, because the idea isn't that the ongoing governance and continuous stakeholder engagement is not continuous. It specifically says continuous for a reason. And so the idea is to make it so that we're never as out of touch again as we were when we started. And I would agree with those who've said, and I think Councillor Roberts has said it, and I think Councillor Moffat has said it. So I would agree that as far as other places where we've done community safety and wellbeing plans go, your community actually is pretty much in touch. We're not sitting here saying that you're badly out of touch, but what we're saying is, as long as somebody can say, I didn't know how to access it, we didn't know the person needed help, we knew, but we didn't tell you, and we didn't know that you could help, then it's not in touch enough. It's not that it's bad now, it's just that there's room for improvement. And so I think as long as this is answering very human questions, as opposed to getting lost in, a $1.62 million program, because that's what's going to make everybody's eyes glaze over. Where will the money come from? And I think Councillor Moffat said this a couple of times, but I just want to reinforce it. Again, going back to public administration, there is investment and there is delivery and there is regulation. And you do all those things, and your ongoing work around setting rules about secondary suites or short-term rentals is your regulatory authority. And every time you do your budget, you do your spending, whether it's investment in a new facility or whether it's operating money. But don't forget the importance of convening and advocacy as being the other big tools of public administration. And when you bang people's heads together and convene them and don't give up, then you force all kinds of conversations, and that's the gap filling that Councillor Moffat was talking about. Maybe it's about using the voluntary sector, and it's not a $50,000 program here and another $112,000 program there. Now, that's not to say that there may not be some pressure from some additional spending, but you want to drink dry all the non-spending investment opportunities and direct delivery opportunities, and save the resources that you have for doing the things that are the hardest to do just by convening in collaboration. And as long as there's gaps in convening and collaboration, that's where something like this can benefit. And so what we really want to emphasize is, it's to the point that Councillor DeVolen made, but I think also to the point that each of you have made in different ways. This is about doing that practical work on a continuous improvement basis, not a grand strategic plan that's going to come crashing on your heads with a huge price tag attached to it. The day may come that a price tag may come, but that's going to be because you validated that it's needed, and then you'll deal with it. And there's always the problems to point to, because advocacy is just as good as convening. So anyway, that's kind of how we see it. And this is really about making sure that nobody can safely say we didn't know, or we didn't know that you could help, or we knew but we didn't bother to tell you. Which are all the kind of, the the editorial cartoon you'd have for that would be the third baseman and the left fielder and the shortstop all watching the ball hit the field, saying, "You got it." No, you got it. Right? So that's as I told you before, you're really seeing why I was a skeptic about these things, and I teased Matt Turigian about it because I guess he was kind of responsible for them. And I was a skeptic because I'm always nervous when stuff comes out of Solgen and lands on municipalities because it sounds expensive. But I actually think if I were going to give an Academy Award for best really cool idea that breaks down silos, that's one of the technical ones that they do the night before. I definitely give it to the community safety and well-being plans because I think there's such a revolutionary approach that you can get into doing the service delivery by forcing people to not hide behind not knowing. So that's why I think this can be such a positive thing as opposed to just another report that you put on the shelf. So I've had to admit to Matt that I was wrong.
And I agree with you completely because, in fact, our CPAC, I authored a letter approved by our CPAC objecting to the introduction of safety and well-being plans, and I find this I've exactly the same as John. In the beginning, I hated everything about this, and now I think this is one of the most exciting opportunities that we've had as a community in a long, long time, and I think it really needs to be said that. We've talked a lot, and I myself have mentioned silos a number of times. We need to remember that when the pandemic came, it was our local service providers and our local agencies that did their own work together. So we are, in some ways, ahead of the game because they just went ahead and did their thing, and they made sure that people who needed help were helped where they could be helped. And we didn't know anything about that. So when we talk about silos, it seems to me it's sort of turning the mirror on ourselves. I feel like the odd man out is local government, but I don't think anyone's made that happen on purpose. I think there's some trust levels that are changing, and I know that some of the service providers and agencies were concerned that this would be a plan that we'd all go yeah and sign it and it would sit on a shelf, and I don't see that happening because there's already too much momentum that those folks have done for our community, and we just need to find the way to plug ourselves into it. And so I think it's pretty exciting, but we'll have to keep our eye on the prize. It would be very easy to lose track of this. And to Councillor DeVolen's early question about duplication, I think we also need to have a hard conversation about where the time of members of council is spent. I don't personally, we need to have a discussion again, well, it's offline things, but do you attend all these meetings and then the same people are contributing from a different chair into the safety and well-being plan? So some of that logistics needs to be sorted out of who's on first and who should stay on first, or or go home. So there's still lots to talk about there. Do you guys want to wrap up, or does anyone else have any speeches they want to make? Okay, take it away, strategy core. Oh, next steps. There we go.
I was on mute. Okay, perfect. So next steps, we are we're focused on taking what we've heard from you today. Every meeting that we have, all the input that we receive, we are perpetually fine-tuning the content that will ultimately go into the plan. So that is ongoing. We are going to do another advisory table meeting to iterate again. And so we're just in the process of booking that now. The survey, as mentioned, is live now. And I believe that we've got someone from the county reaching out to the municipal level communications contacts to help disseminate those more broadly. And just another point on that, some service providers have asked that they receive hard copy, or that they want to print out hard copy and mail them back to us. And we're absolutely happy to do that. Working with the library, the public library, because they are a good access point to contact and reach those who might not be directly connected to services, but are still using community spaces. So working with them on that. We are, as I mentioned, doing ongoing drafting of the plan. But as we continue to have these meetings and, identify new sources of data, that is being updated. And our next meeting will focus on like a annotated outline, so a very detailed outline of what it's going to actually look like, structure and things like that, to give you a preview before we then start to fill it in more detail and look towards finalization and thinking about implementation considerations. So that's really where we're headed. We did come right up against summer in the height of engagement with advisory table and with focus groups and the survey. So now that we see over the hump of Labor Day and people are getting back into their as much of a normal schedule as possible, hopefully with kids safely back in school, we expect to be able to schedule and book all of the last few meetings with a bit more ease, and really look forward to meeting with you again and updating you on where we've come from this point.
Okay, that's terrific. And sorry for what appears to be my inattention. I have a very large puppy that needs to go out. So our timing is perfect. And he's eating the chair. Any further thoughts, comments from anybody on the screen? I would like to thank you all for your participation, and certainly to the folks in Strategy Core for the work that you've done to date. It's a big bite, but we'll get there. And I would look for a mover and a seconder to adjourn the meeting. Councillor Burton, Councillor DeVolen.
Moved by Councillor Burton, seconded by Councillor DeVolen. Be it resolved that the Haliburton County Community Safety and Wellbeing Plan Steering Committee now adjourned.
All in favor of that? Great, thank you. That's carried. Thanks again, everybody, and we'll carry on with next.
Oh, there, that's what we wanted to see.
Yeah, that's what you wanted to see. Here he is.
That's a big puppy. That's a big puppy. He's grown 6 months.
I know, wait till he's a year.